Welcome to The Balancing Act. I'm Olga Villaverde.
And I'm Montel Williams.
Today, Montel, in honor of May being Lupus Awareness Month, we've got great news for the lupus nephritis community, which until recently, there really hasn't been a lot of treatments available. But good news, I said.
Absolutely. And as someone, dealing with an autoimmune disease myself, I can testify that the more treatment options that are available, the better for the patients.
Absolutely. Plus, you got to believe how one New York City-based group is helping older foster kids get adopted. Great story.
And get this, a little help with hair growth.
I'm not laughing at you.
Oh, gotcha.
The Balancing Act starts
right now.
You Gotta Believe has been helping foster kids connect with permanent parents and families for more than 25 years, focusing on young adults, teens, and preteens who are most in danger of aging out of the system alone. Well, today we're joined by three fabulous folks who are making a difference every day with their work at YGB. First, Jennifer Pinder, she's their executive director. Rosie Williams is their youth advocate. And actor Willie Garson, who is on YGB's Board of Believers. Welcome to all of you. Willie, you're here today because this is a topic that is truly near and dear to your heart. Tell me why.
I was in a long relationship, and she never wanted to have kids. By the way, not just with me. Like she didn't want to have kids, which is totally fine. I was in my early 40s, and I was like, how do I get a kid? Like I had done a lot of fundraising for a group here in Los Angeles. And I called up the director, and I'm like, what if I wanted to do this? And she walked me through it, and I went through LA County, through public adoption, and I found out how many kids that were available.
Jennifer, I mean, this is such a great organization, and I was reading here that there are more than 400,000 children in foster care in the United States. That is so sad. And every year, as many as 17,000 will age out of the system.
That's exactly right, Olga. They really are scary statistics. And as you mentioned, You Gotta Believe has been around for over 25 years doing this really difficult work of trying to find permanent families for older kids in foster care. We are the only organization in New York that specializes in that way, and we provide ongoing support to our youth and families indefinitely. 17,000 kids age out. And that means that either at the age of 18 or 21, depending on which state that you're in, that you're really just released into the world and expected to navigate it on your own if you haven't been connected with a family. And that really is just, it's unacceptable.
Rosie, I understand you're a youth advocate, and you obviously know what it is to be part of this system.
Yes, so I've been in and out the foster care system in New York City. I've been in over 30 foster homes. So when I met my mom, it was kind of difficult because I didn't understand sitting at the table, eating dinner, arguing and laughing, and still being a part of a family. So I'm 28 now. I'm still home with my mom. She loves me. I have a family, little sisters, and I don't have to be anybody else.
Well, what an amazing story, and even what she's doing today. It's just unbelievable.
Yes, Rosie is such an integral part of our organization. As a youth advocate, she's providing support to the youth who we are trying to find permanent placements for, and she has been through it, so she can really provide the guidance that they need because she's experienced what they've experienced. And May is National Foster Care Month, so now more than ever, we want everyone to be reminded that everyone needs a permanent home.
What advice do you have for potential parents who have thought about this?
Just to take one step at a time. For example, when you're going through your parent training, they have to cover a lot of information, and they're like, you're gonna have to do this, you're gonna have to do this, you're gonna have to do this. And I said to my social worker, just tell me what I have to do tomorrow. We have social workers or organizations like You Gotta Believe, which step in and walk you through all of it and stay with you forever. So you're not alone, and you just have to find them. We are serving one up to your viewers right now. So YouGottaBelieve.org is in New York, and they will walk you through the process and help you. They help you find the kid even.
Rosie, any final thoughts?
Learn about the youth and what they're going through in the system, and see if you're ready to be a parent. It's not that hard. The youth want a life. The youth want some love and some caring, some support, and that's it. That's all that it takes to be a parent.
Willie, before we leave you, any final thoughts for anyone out there?
Well, I just want to bust like 2 myths, and one is that it doesn't cost anything. Like people think it's really expensive. You go to nonprofits like YouGottaBelieve.org, there's a whole system in place that takes care of it. So it's free. People think it's expensive. It's not. The other thing is that there's nothing wrong with these kids. They're not damaged. They just have been in a family situation that wasn't able to take care of them permanently. Give a look at YouGottaBelieve.org, and if you can't, if you're not someone who's looking to foster adopt, then donate and support them. So there's 400,000 kids in America waiting to be foster adopt. So go for it.
Oh. Thank you, Willie, so much, and good luck to you and your son, and thank you for believing.
Oh, thank you. Thanks for having us.
Thank you, Olga.
Thank you guys so much.
And as always, if you'd like more information, you can go to our website, and it's thebalancingact.com. Millions of Americans, both men and women, suffer from hair loss by the age of 50. And I know this, 85% of men and some women have experienced thinning hair or hair loss, according to the American Hair Loss Association. Genetics, disease, stress, environment, that all plays a factor. And hair loss can be absolutely devastating for self-image and emotional well-being. Here to talk about the daily struggle and offer help, yes, there is help, is Darian Braun, founder of Accelerate 35. Welcome, Darian.
Hi, thank you for having me.
I love talking about this because I think everyone out there, most everyone can relate to this.
Yep.
There's physical challenges, emotional, spiritual, when it comes to the hair loss. What inspired you to take this journey to help?
Well, I got asked by a woman who was sick for help, and she had lost her hair, and she was her crown, and it was her confidence. And come to find, it's a common story around the globe.
It is.
I've got hundreds of thousands of stories right now of people just saying thank you because they had no hope. They've tried all the pills and potions and lotions and all the snake oils. And it's hard being in this industry and saying, I can actually grow your hair.
Nobody buys it.
No.
I know. So what did you do next to help?
I went and locked myself in the lab for 3 years, 79,000 man hours.
Wow.
15,546 formulation changes. And mostly nothing worked for the first year. Millions were spent. I found the American Indians. So I went up to South Dakota, went to the reservation.
That's interesting.
And I was supposed to stay for a few days. I ended up living there for a little bit. And sure enough, the herbs and florals helped close the cuticle. And that was part of the puzzle. And then it started falling into place.
And it's called
Accelerate 35.
35, I believe, is because of the 35 ingredients inside.
Exactly.
Tell me how that works, what they are.
They are a racing engine for growing hair, and it's the fastest thing on the planet. Our competition out on the market, any one of our competitors, will tell you that you will see some form of hair growth in 4 months.
Wow, 4 months?
Yeah. So I had to go do clinical trials, and they made me do it twice because they didn't believe it.
And it worked.
268% increase in 14 days, 53% increase in length in 45 days. That turns out to men thinning hair, no more. Women wanting hair extensions, no more.
All right, so let's talk about how it works. You have, and I see behind our big screen there,
yes,
a shampoo, conditioner, and serum.
Now the serum's in each one of the, in everything.
Okay.
So you're always using the serum. It's in the shampoo, it's in the conditioner, and it's on its own.
But how do you want someone to use this? First a shampoo?
Well, wash your hair
Okay.
twice, get it clean, rinse it out, put some conditioner in if you want, and then when your hair's wet, spray on the serum as much as you can. Saturate your head, scrub it into your scalp, comb it through root to tip, dry as normal.
For our viewers who'd like more information, where can they go?
GetX35.com.
Fantastic. Thank you so much for coming in.
Oh, it's been a pleasure. It's my pleasure. I'm going to grow your hair and I'll be back in 90 days.
I'm going to hold you to it. See you in 90 days.
Wait a minute. What do I get out of this?
You get a thank you.
Okay, I'll do it.
And if I don't get hair, I get a refund.
You'll have hair.
If you'd like more information, go to our website, thebalancingact.com. Systemic lupus erythematosus, SLE or lupus, is a chronic, complex, and often disabling autoimmune disorder in which the body's immune system attacks the body's own cells, tissues, and organs. It affects as many as 300,000 people in the United States, and an astounding 90% of those diagnosed are women. If you have lupus, you're always at risk for developing a serious complication of lupus impacting the kidneys called lupus nephritis.
I was diagnosed with lupus at the age of 16. During my teenage years, I went from running track, being an active, normal teenager, dancing, and beauty pageants to not being able to walk up the stairs at school. Lupus came along and just changed all of that. It stripped me of everything that I knew. My doctors at the time decided that I should be homeschooled because my immune system was quite low. I was on very high dose of steroids. It wasn't easy in college as well. I noticed that my urine was quite cloudy and that I would have swollen ankles and feet quite often. But at that time, I was on a cocktail of drugs and I didn't think anything of it.
In the early stages of lupus nephritis, there may be very few signs that anything is wrong. In fact, some people have no specific symptoms. Symptoms of lupus nephritis may include foamy, bubbly, or frothy urine, swelling that occurs when your body has too much fluid, usually in the legs, feet, or ankles, weight gain, and fatigue.
It was my sophomore year of college where it got to a point where I had a hard time breathing. I ended up in the hospital. They were telling me that my kidneys were shutting down, and it was quite a scary time in my life. They put me back on the steroids, heavy doses, and they let me go. A year after, it's when my primary doctor decided to have me see a nephrologist, and he said I needed a biopsy.
Dr. Donald Thomas has been a leading advocate and medical expert in lupus and lupus nephritis treatment and education for over 25 years.
I follow my systemic lupus patients every 3 months religiously because about 1 out of every 2 of our systemic lupus patients will have a problem where their lupus attacks the kidneys, a condition called lupus nephritis. And the best way to pick that up is by getting a urine sample and seeing an elevated amount of protein in the urine. The elevated protein in the urine is the most important laboratory test. So when I see an elevated amount of protein in the urine, I'll send my patient to a specialist who does kidney biopsies. Getting the kidney biopsy is the gold standard for diagnosing lupus nephritis. The quicker we can diagnose it and the faster we can treat it, the greater chances we have of preventing kidney failure.
Lupus nephritis is more common in younger women. There is also a higher incidence of lupus nephritis among specific racial ethnic groups.
After the biopsy, the doctor gave me a diagnosis of lupus nephritis. I was 25. It was a scary moment for me. I wish that at the time when I was having the constant, frequent urination and the swelling of my feet and ankles, that they would have told me then that, there was inflammation in my kidneys. One of the main reasons I advocate for lupus nephritis is because, we need our kidneys to live. Nobody wants to have to go through a kidney transplant. We do need a cure for this. And if we don't have a cure, at least we need better medications.
We finally have an FDA-approved oral therapy in my toolbox that I can reach for to treat my patients with lupus nephritis, and that's Lupkynis. Lupkynis is a prescription medicine used with other medicines to treat adults with active lupus nephritis. Lupkynis should not be taken with a medicine called cyclophosphamide. Make sure to talk with your healthcare provider if you're not sure if you take this medicine.
Lupkynis is the first and only FDA-approved oral medication for the treatment of adults with active lupus nephritis. It has been proven in research studies to help control lupus nephritis and protect the kidneys from further damage without high-dose steroids. Lupkynis can cause serious side effects, including increased risk of some kinds of cancers and infections. Talk to your doctor about the benefits and risks of Lupus and if it may be right for you. The complete safety information will be shared later at the end of this segment.
Lupus has helped transform the way we treat lupus nephritis. In research studies, people who took Lupus as part of their treatment plan were about twice as likely to have their lupus nephritis under control at 1 year of treatment compared to those who only took mycophenolate mofetil and steroids. Lupus helped to stop the attack of lupus nephritis while using lower doses of steroids than doctors normally would. Lupus helped to reduce the protein in the urine, or what we call proteinuria, which is a key sign of disease activity, roughly twice as fast than mycophenolate and steroids alone did. People who take Lupus had a 50% reduction in their proteinuria after an average of just 1 month. Lupus was tested in research studies that involved more than 350 people across different races and ethnicities.
Aurinia, the company that makes Lupus, created Aurinia Alliance, a personalized support program to help better understand lupus nephritis, assist people taking Lupus in navigating insurance and funding options, and support them to help stay on track during the Lupus treatment journey. For more information about Lupus and lupus nephritis, visit lupus.com, and you can always go to our website, thebalancingact.com. Important safety information. Lupus can cause serious side effects, including increased risk of cancer. People who take Lupus have an increased risk of getting some kinds of cancer, including skin and lymph gland cancer, lymphoma. Limit and avoid exposure to sunlight and UV light, such as tanning machines. Wear protective clothing and use a sunscreen. Increased risk of infection. Lupus is a medicine that affects your immune system. Lupus can lower the ability of your immune system to fight infections. Serious infections can happen in people taking Lupus that can lead to hospitalizations and can cause death. Call your healthcare provider right away if you have symptoms of an infection such as fever, sweats or chills, cough or flu-like symptoms, muscle aches, or warm, red, or painful areas on your skin. Do not take Lupus with medicines known as strong CYP3A4 inhibitors, such as ketoconazole, itraconazole, clarithromycin, or if you're allergic to any of the ingredients in Lupus, you should not eat grapefruit or drink grapefruit juice while taking Lupus. Before you use Lupus, tell your healthcare provider about all your medical conditions, including if you plan to receive any vaccines. You should not receive any live vaccines during treatment with Lupus. Other vaccines may not work as well during treatment with Lupus. Have or have had liver, kidney, or heart problems. Have high blood pressure. Are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed when taking Lupus. When taking Lupus in combination with misophenolate mofetil, read the medication guide for misophenolate mofetil for important pregnancy information. These medicines can harm your unborn or breastfed baby. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Lupus may affect the way other medicines work, and other medicines may affect how Lupus works. Lupus may cause serious side effects, including kidney problems. Kidney problems are common side effects of Lupus and may be serious. Your healthcare provider may do certain tests to check your kidney function while you take Lupus. High blood pressure. High blood pressure is a common side effect of Lupus and may be serious. Your healthcare provider will monitor your blood pressure while you take Lupus and may ask you to check your blood pressure at home. Nervous system problems. Nervous system problems are a common side effect of Lupus and may be serious. Call your healthcare provider or go to the nearest hospital emergency room right away if you have any of these symptoms while taking Lupus. Confusion, changes in alertness, muscle tremors, numbness and tingling, headache, seizures, vision changes. High levels of potassium in your blood. Your healthcare provider may do certain tests to check your potassium levels while you take Lupus. A serious heart rhythm problem, QT prolongation. Severe low red blood cell count, anemia. Your healthcare provider may check your labs while using Lupus. The most common side effects of Lupus are diarrhea, headache, cough, urinary tract infection, stomach pain, heartburn, and loss of hair, alopecia. These are not all the possible side effects of Lupus. For more information, ask your healthcare provider. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to fda.gov/medwatch. Please see prescribing information, including boxed warning and medication guide for Lupus.
Thanks so much for joining us.
Remember to head to our Facebook page and our website and follow us on Twitter.
And you know what you got to do. You got to stay safe, love that family of yours, and we'll see you next time.